Well, good morning, everyone. I want to thank everyone for coming out today for another COVID-19 update from the city of Richmond. And hope everyone had a reflective Memorial Day weekend. As of today, in the city of Richmond, it's confirmed that we've had 1,112 positive cases of COVID-19. And as of today, we've had 21 deaths due to COVID-19. Earlier this month, the governor stated that the state's reopening plans represented the floor and not the ceiling for restrictions required to support public health. And in accordance with this statement, I sent a letter requesting that the city of Richmond be allowed to move into a modified version of Phase 1 that maintains current restrictions for places of worship and personal care and grooming based on the enhanced risk of close contact or mass gatherings. Now, I made that request based on our local data, my conversations with local businesses, faith and community leaders, and my belief that a sustainable reopening for the city requires a locally informed strategy that protects those who serve us all. Unfortunately, based on his letter of yesterday afternoon, the governor did not authorize the modified phased reopening plan that we requested. Now, we've always believed that in this public health crisis, it's not a one-size-fits-all model for each locality. This decision places us in the position of deciding whether to move forward into Phase 1 this Friday as the governor's order expires on Thursday. And as I said from the beginning, the data and our ability to protect our most vulnerable must guide our decision. As you can see from this chart to the left of Dr. Avula, the most recent data shows a flattening of the percent positivity rate over the last 7 days. We are obviously now not out of the woods just yet. Data from our hospitalizations and intensive care unit availability shows significant capacity. And in the past 2 weeks, we've implemented a tested technique for boxing in the virus. We will test, we'll trace, and we will isolate. We've expanded testing, built our contact tracing apparatus out, and we're ensuring that everyone who is COVID-19 positive can isolate safely. We've partnered with the state to distribute protective supplies in the neighborhoods that need them the most. And also in collaboration with the Commonwealth, we are adding significantly to our staffing at the Richmond City Health District to investigate new cases of COVID-19 among city residents and conduct subsequent contact tracing. And we've successfully advocated for a statewide face covering requirement, which the governor announced yesterday afternoon. And we all know that data shows that that simple step alone can significantly reduce the transmission of this deadly disease. Now, when I look at the picture in its totality, given the added tools at our disposal, the current trends in our local data, and my faith and belief in Richmonders to look out for one another, I believe that Richmond can cautiously, and I repeat cautiously, move into Phase 1 starting this Friday, May 29th. Now, what does this mean? In Phase 1, retail will be able to operate at 50% of capacity. Outdoor seating at restaurants, patios will be available at 50% of capacity. Houses of worship will be open at 50% capacity. And personal grooming barbershops, and beauty salons will be open by appointment. What will not be open will be entertainment establishments, fitness establishments, gyms, things of that nature. They will remain closed. You will be able to now visit your gym if you do the workouts outside. Consistent with my requests to delay certain aspects of Phase 1 reopening guidelines, in order for this reopening to be sustainable and safe, my administration is taking steps to lift some of the best practices among our faith communities and local businesses. These practices are rooted in conversations with the business community, with our faith leadership, and health professionals, and will protect the Richmonders, both those that are the staff in these institutions and those that attend and patronize them. First and foremost, we're asking everyone to wear your mask and cover your face when you are in public spaces, especially if it's challenging to maintain a 6 feet distance between individuals in that space. To our faith communities, I recommend you continue to operate virtually and refrain from in-person gatherings. If you choose to gather in person, I strongly recommend you do so outdoors while practicing strict social distancing. Our neighbors in Howard County, Maryland, have done just this, keeping indoor services small and opting for a distanced outdoor and virtual gatherings. To our restaurants and our breweries in town, for those who choose to open, we ask that you offer outdoor seating at half capacity. We're asking that you voluntarily keep a log of people you seat. You may ask why. This will help us in our contact tracing efforts by asking for the name and number of each group of diners, the same as you would with a reservation. Now, this is completely voluntary for both individuals and restaurants, but this small amount of information will help the health district trace and contain outbreaks should they occur. Now, I hope this data will not be necessary, but we want to be prepared. We believe that this will give your patrons the confidence that you are truly doing everything in your power to keep them and your staff safe. We ask that you join us in this effort. I'm also continuing to request that the state support us in our effort to control the spread of the virus. I'm asking the state to help us expand our testing capacity. We've done a good job, and I want to applaud the Richmond City Health District in helping and partnering with us to ensure we get to some of our most vulnerable communities. But in partnership with the state, we're doing our first mass testing event today in the South Side, and we have another large event on Saturday in the East End. We need the state support to do these types of mass testing in all corners of our great city. I'm also asking the governor to help us ensure adequate PPE access in all corners of Richmond. We appreciate the state's support with getting 40,000 units of PPE that were distributed by the Richmond Fire Department over the past 2 weeks. They actually wrapped up yesterday. We've also worked with the region to source PPE toolkits for small businesses. But quite frankly, we're going to need a whole lot more to support our residents and our businesses to reopen safely and sustainably. We're working to source cloth masks for our communities, but we request their continued assistance to ensure the vulnerable communities have what they need to protect themselves and neighbors through this pandemic. And I would be remiss if I not thank Chamber RVA and our partnership with our neighboring counties as well in the creation of these toolkits to be distributed to our businesses. This morning, I started my day at the Arthur Ashe Center. As part of the distribution, it was great to see businesses who are expecting to open Friday come out and pick up toolkits to get started in keeping our patrons, our residents, safe. Now to the members of the business community. I want you to know that the city is an ally in this effort. I have the utmost faith in both our residents and our businesses that those who do open will do so in a safe and respectful way as possible. I trust our businesses. I trust the businesses who do choose to open and will do so with the utmost regard for the health and safety of their patrons and their employees. I want you to know I trust our residents who choose to go to a restaurant or even a barber will not do so if you have any symptoms of COVID-19 or believe you've been in close contact with someone with symptoms, and that you'll wear your mask no matter how good you feel in any of these establishments. Now, our restaurants are used to the high standards of cleaning here in Richmond and are prepared to follow the guidelines for PPE and social distancing that the governor has laid out in his reopening plan. And for those who have questions, we're working to make those expectations clear to you at our website, rvastrong.org. But I also say to those restaurants and personal grooming businesses that do not feel comfortable or prepared to move into phase one, that I respect your decision. I appreciate your dedication to public health and for your concern for your employees and for your patrons. In his response to my request yesterday, Governor Northam cited his position that just because a business can open does not mean they must open. I, for one, will support you in that decision, and I believe our community and your patrons will support you as well. Now, I urge all business owners to visit rvastrong.org/reopening guidance to sign up to receive PPE toolkits, inquire about new or expanded patio space, and view up-to-date guidance from the city. Now, I make these recommendations and requests of the state because, as has been my mantra this entire pandemic, reopening should be slow, steady, and cautious. Slow, steady, and cautious. Every decision we've made at the city has been informed by input from the business community, from our faith leadership, and of course, our medical and health experts. Because when public health is on the line, everyone, blindly pushing forward is not an option. Not an option. Decisions must be thoughtful, and they must be based on our collective knowledge of love within our city. Now, I stand behind the decision to request a 2-week delay, and I stand behind the recommendations I've made today. We are fighting for a safer and stronger Richmond, and that's what this has always been about. Public health and public safety first. Now, we begin this journey together. But that does not mean that we are out of the woods, ladies and gentlemen. This pandemic is not over by any stretch of your imagination. This pandemic is not over. So I request that you wear your mask, that you stay home if you can, that you stay safe, and that you stay strong. And I remind you that we are in this together, and I ask that we rise to the occasion together. With that, I'll ask Dr. Avula to provide some remarks and an update on the status of our public health here in the city of Richmond. Dr. Avula.
Good morning, everyone. I just want to talk briefly through the data that the mayor pointed out and how that factored into some of our decision-making here in the city. What you'll see is that yellow line, the percent positivity over a 7-day period, so it's a 7-day moving average at each point, has been pretty flat since about May 15th, May 16th. That number, that 7-day average, has hovered between 23 and 24%. You'll also see that line stops short a few days. The last 3 days, the way that the VDH algorithm works is that it does not include the most recent 3 days just to make sure that data gets complete, because these are posted by date of lab report. And so if we look at the preliminary data, it confirms that the last 3 days have shown somewhere between 23 and 24% positivity as well. And so altogether, that gives us almost a 2-week period of a fairly flat percent positivity trend. That's not ideal. Obviously, we'd love to see that number going down. But remember that this is not the only data point we use. So in addition to the percent positivity trend, we also look at hospitalizations, death rates, and hospital capacity. I think I mentioned to y'all last week that in a conversation late in the week with our senior leadership of our 3 health systems here in town, that there is adequate capacity, that none of our health systems are showing any concerns from a staffing or from a bed availability at this standpoint. Things seem to be in pretty good shape as far as hospital capacity to meet the acute needs of patients if we do indeed see a surge. In addition to all of that, as we start to unpack this data a little more, we've seen that a lot of our disease, a lot of our numbers here in the city are really due to extensive spread in largely Spanish-speaking communities. We've been talking about that over the last couple of weeks. The city data shows that over 30% of our positive cases are in people of Hispanic ethnicity. And so we have really stepped up our efforts and our outreach in those communities in a few different ways. One, we've increased our on-the-ground presence to get good information out with bilingual staff, with community health workers, with other volunteers who are trying to increase our presence, increase trust, and increase knowledge about how to respond to this pandemic. Two, you've heard about the city's efforts to really significantly expand our ability to effectively quarantine and isolate individuals. And so now that program has been built out. We have a screening process in place for our case investigators and our contact tracers who can work through each individual situation and determine whether somebody needs to be housed outside of their current setting to effectively quarantine and isolate. And thirdly, we are really ramping up testing in those areas as well. We're back at Southwood today, and we'll continue being very aggressive about testing all over the city and the county with a particular focus on those neighborhoods with predominantly and uninsured minority residents of our region. I'll say that obviously these decisions are difficult when we don't see the nice downward trend that we're seeing in other parts of the state, but taken in their entirety and along with the mask mandate and these additional efforts, as the mayor said, a cautious move into phase 1 is the right thing at this point. Thank you.
All right, we'll take some questions.
Mark? Thanks for holding this, Mr. Mayor.
Yeah.
Yesterday in your letter to the governor, you said, quote, "The percent positivity data recently reported by VDH for the city of Richmond still shows a concerning upward trend." Those were your words. Today you guys are saying that it's mostly flat. Which is it?
I mean, we sent the letter. No, go ahead.
So when we drafted the letter 2 days ago, it did look more like a flattening upward trend. The last 2 days of data, if you'll look on the website, you can look at both the 24th and the 23rd. That 7-day moving average has stepped us downward in successive days. And then, as I said, that preliminary data continues to look like a little bit more of a downward trend. And so, we're all doing a little bit of ballparking here, but as you look at the actual percent positivity from May 15th on, somewhere between 23 and 24%. So it has continued to flatten since we drafted the letter a couple days ago.
And specifically services, how are those settled on? Is there data that suggests that there are outbreaks linked to those two types of services? Is there something else that went into that aside from just the public conversation around concern?
Yeah.
Yeah, Mark, I think if you did a survey and looked at some other states, you would see that entering back into churches in half capacity or barbershops and beauty salons, that sort of grooming, they are actually in later stages in other states. Phase 3, phase 2, different. I think from day one, I think the question that may have come from you, Mark, some weeks back, that I had some serious concerns about people entering churches again, particularly our most vulnerable, that more senior elderly population. I just have a difficult time thinking that anyone should be in a movie theater, going back into plays or anything of the sort, and also going to church. And I think with grooming, even though it's by appointment, you still put people in close proximity to one another. It's kind of hard and difficult to cut someone's bangs from behind. You get to be in their face. Very difficult thing to do. We expressed our misgivings to the governor because of what we heard from business owners in those worlds, barbershops, beauty salons, faith leaders as well. I'm grateful for some of our faith leaders who've expressed to me that they do not plan on going back and opening up their houses of worship anytime soon, particularly not in the month of May. I'm grateful for their support in that. And I've heard from a number of owners of beauty salons and barbershops that they're not comfortable going back. The uncertainty of the unknown is still out there. And as I stated earlier, I stand by their decision if they choose not to reopen. This is about building confidence, not only for the employees who work there and put themselves in that danger zone, you can say, but also for the customer that comes in as well. Without a doubt, I have full faith that Richmonders, whether they're in our business community or their patrons and customers, will rise to the occasion and adhere to the mask guidelines as well that the governor has laid out. I think personally that is a game changer. You take all those tools in its entirety that's available to us right now, the ability to isolate, the built-out contact tracing capacity, the expanded testing, and now you add the mask to that as well. I think that we can cautiously move into phase 1. I preferred a more modified version, a more delayed version, but as I said, I have faith and the belief that our Richmond will rise to the occasion.
Cameron, Mr. Mayor, can you walk us through this, the request to voluntarily log patrons at restaurants? I believe you said that it needs both the, approval or volunteering from both the patron and the business. Is that correct?
That's correct.
Okay, and in that case, how did you decide on, explain why doing that? Why just restaurants and why not potentially other businesses that are going to start reopening this phase 1?
Well, the phase 1 for these other establishments, particularly barbershops and salons, will be by appointment. So you'll have some contact information there. For restaurants, some will be taking reservations. I've heard that from a number of restaurateurs. And as I stated earlier, Cam, that this is a volunteer thing. There are going to be some people who say, I'm not getting you anything, right? And there are going to be some restaurants who say, I don't want to take your information at all. And that is just fine. However, as I stated at the end of my remarks, that we are in this together. And that means I would like to have the ability to see whether or not if someone were to be contract COVID-19, that I think it's good for the public to know the people who may have entered those establishments. And so it's going to take a commitment from both the patron and also from the restaurant, but it's all voluntary. Go.
One other thing I would add to that, Cam, is that the way that this disease is transmitted is a function of exposure, which is accentuated by proximity, and time. And in a restaurant setting, you've got a group that comes together, they're sitting at a table potentially for an hour or more, and so that exposure and time factor really increases the chance of exposure. Whereas in another type of retail business, typically you're meandering throughout and then in and out in a much shorter period of time. So, none of these systems will be perfect, but I do think that restaurants do pose an additional risk that we want to be as careful as possible and have as much information as possible. If we do trace a case back, then that will make that contact investigation much easier.
Henry.
Mr. Mayor, what are you all seeing that the governor's not seeing in terms of making that request for the modified phase one? What is it that he's not seeing that you guys have your hands on that says, we really needed to do this modified phase one?
Yeah, I think, in government and democracy, you're always going to have a difference in opinion. We have a more vulnerable population here in the city of Richmond. We've always had a population that is that has lower socioeconomic status than the average Virginian. The city is more diverse than the average Virginia locality, and as you see from our data, it makes us, our people, a little bit more susceptible to this virus. And so just out of caution, we've chosen to be slow and steady about our reopening approach. And I think that is important and significant, particularly when you look at the data, but also understanding that we recognize the people who live in our city, and particularly in some of these most vulnerable neighborhoods, are the ones who likely either they've been had to continue working or will likely have to go back to work as well. And so all these factors played into why we asked for the modified approach. We understand and respect the governor's reasoning, and that's why we're moving forward in a cautious way. And we're going to put our faith and belief in the people who make this city great, and that's everyday Richmonders.
Thank you. We know that Northern Virginia is the hardest hit region of the state. If they're willing to move into phase one, why did you think Richmond needed a special plan?
I think the answer I gave to Henry, I think would apply here as well. Just our population is a little bit different. I've always believed that it's not a one-size-fit-all model for each locality. Each locality is different, and I really did worry about whether or not that we were putting people in the line of danger moving forward. And I think that my utmost priority, number one priority, has to be public health for everyone. But as I stated earlier, I think that Richmonders, whether they're in the business community, whether they will patron and be customers at these establishments, will rise to the occasion without a doubt. We've done so already. I think if you look at the behaviors of Richmonders compared to other localities, I think that you will see that we've done a really good job in masking up and adhering to our social distancing policies. Obviously, we can do better. When we challenge Richmonders to do better. And I will add to this as well, what we want to prevent, right? We ask you to adhere to these policies and these guidelines. What we want to prevent is going back into phase zero, right? That is the most, I think, dangerous part of this, is that if we don't use our masks, right? If we don't grab the mask before you leave your home and enter any of these establishments or any of these public spaces, we risk going backwards in this approach. My belief and hope is that we can shift up in a slow, cautious way, but we allow folks to get back to at least a modicum of normalcy. But it's going to take everyone complying with the guidelines. And I believe they will. I've already seen it. If you drive down Broad Street or you walk in some of our neighborhoods, people are walking around with masks, even in public areas they don't have to. That shows that folks are going the extra mile, and that's what we're going to need right now in this most critical moment in our city's history.
Mark?
Oh, Danny wants to add to that.
One other point about why a different approach here in Richmond as compared to Northern Virginia. The mayor has said all along that we're going to use data to help drive those decisions. The data in Richmond looks really different than it does in almost every locality across the Commonwealth. In almost all of the localities in Northern Virginia, that percent positivity trend is significantly decreasing, whereas here and in a couple of other places across the Commonwealth, we see more of a flattening or even an upward trend. So the data was a big part of that caution.
This one's for Dr. Avula. Is there anything that you've seen in the data in Henrico or in Chesterfield that would point to indoor gatherings for worship or these personal grooming services leading to small outbreaks in those localities that have
Yeah, the question is, has anything in the data in our surrounding localities pointed to outbreaks or the expansion of disease in faith communities or grooming salons? The overall data in Henrico, which is, I'm really looking at Richmond and Henrico particularly, has also stayed very flat over the last 3 weeks or so. We are not actively working outbreaks in any kind of barbershops or hair salons. Again, it's only been a week, and even in the county, a lot of that approach has been fairly cautious. What we're hearing from our colleagues and business owners is a real hesitation, both on the part of the business and the patrons. There have been, a number of congregational outbreaks that from the beginning of this, really kind of dating back to the beginning of March. And I think that trickle through March has really impacted faith leaders' approach into this. I've sat in on several of the calls that the mayor has hosted with our congregational leaders, and all of them, this is very real because their own congregants or people they know have passed away because of this disease. And it has really changed the conversation and the decision making, both for the faith leaders, but also for the other congregants. I mean, we're very consistently hearing, hey, let's not rush into this. Let's wait until late summer. I've even heard from one congregation, they're not even contemplating opening up until next spring. So no recent active outbreaks, to your question, that are driving that, but that's kind of the sense that we're getting as we talk to many of these leaders across the region.
Cameron, has anyone so far utilized the hotel program that you announced last week? And then as well, I know we kind of asked the governor this when they started the state going to phase one, but do you all sort of have benchmarks in your mind of looking down the road where cases go to a certain point where you're saying, okay, we have to start discussing going back to phase zero?
So the first question is, has anybody used the hotel placement for quarantine and isolation? Not yet. We've obviously every day we're talking to new positives and we're talking to their contacts. And the criteria are pretty detailed, right? Because each of those situations has a lot of intricacies that we've got to get into. How many people live in the house? Are you a caretaker of children? What's the physical layout of the house? And do you have the ability to have access to a bathroom without much shared interaction with the other household members? Is everybody in the house already symptomatic, in which case there wouldn't be a need for further isolation? So each of those situations just takes a little bit of peeling back the layers from our case investigators and contact tracers. So nobody has needed it yet. And remember, it's only been about a week since we've put the screening into place, not even that at this point. So I fully expect that we'll have situations where we need it. Thankfully, the system has been built and the continuum of care has agreed to help do that placement. The second question was, are there specific benchmarks that we would look at to pull back? Is that right? So, I think the data points we've talked about, both at the state and the local level, are the things that we'll continue to pay attention to. What is our trend in case rates and positivity rates? And then the outcome data. Are we seeing an upward trend in our daily death rate or our daily hospitalization rate? And then ultimately, that hospital capacity is one of the things that has been a priority for us to preserve. And if we get to a point where the hospitals are quickly trending upward and can't meet the demand for the surge, then I think all of us, not just here in the city of Richmond, but across the Commonwealth, really need to think hard about what it looks like to pull back so that we can maintain that capacity.
Henry. Mr. Mayor, as we head into phase one starting Friday, do you have any plans on going out and taking advantage of any of those lifting of restrictions? A haircut, eating out, being out?
The question is, do I have any plans on going out this weekend? Well, I think it's become very obvious I'm in desperate need of a haircut, but that is not on my agenda this weekend at all. I may stop by one of the citywide testing sites this weekend, but nothing is on my agenda. I plan on continuing to take out, carry out, and deliver food and support local restaurants in that way, and I request that folks continue to do that as well. Chop Chop is a great app to use locally and order food. We'll get through the weekend and then we'll see what happens after that.
Laura, last question.
Mr. Mayor, why do you think it's the
Yeah, well, the letter that we sent to the governor was a couple days ago when we decided that we made the decision that we think we should enter phase one. It should be in a more slow, steady, and cautious way. And we needed it to happen soon because we knew that Thursday the order would expire for the city of Richmond. And you, I think, understand the city council process probably better than most, that it would take about 14 days for any ordinance to work through the council's legislative process. And so with Friday bearing us down pretty soon, we thought the best way to get that sort of relief in this state of emergency was to petition the governor once again. And also understanding that the governor stated some weeks ago that this was the floor, not the ceiling. And so we thought this was the best local-focused approach, but nonetheless, I think that Richmonders will rise to the occasion, and we'll be ready to go come Friday.
Thanks very much, everybody.
Thank you, everyone. Be safe and strong.